Thank you, and thank you for asking us to speak today and present some of our work. We want to illustrate three key things for diabetes, endocrine, and obesity, and that is our role in system-wide collaboration as three very large clinical providers, and how we work across the system with our partners, how we are trying to address our variation in the quality of care and access problems to people with care. And Dr. Vas will speak about that as it pertains to one aspect, which is diabetic foot care. And then how we really want to address health inequalities, and Dr. Duncan will speak to that, and how we are trying to adapt some self-management approaches to address that. So I will start off by talking about our partnership working across the system. And I want to illustrate that through our work in a newly created Diabetes and Obesity Delivery Board, created in South East London through the ICS, chaired by Jill Lockett, and really bringing together the strength of KHP with all the local partners, with primary care, and with the Health Innovation Network. So this is a fantastic opportunity to bring together all the relevant players in how we address diabetes and obesity care throughout South East London. It has a clear mission to be a learning health system, and we really, and I'll try and illustrate this, want to be data-driven in our approach, really analysing the care we provide and bring in the academic strength of KHP and the HIN together to learn, to develop, and to progress within that. So at a population level, which is crucial for us, we want to improve the diagnosis and the early intervention and prevention of diabetes and obesity. We want to have really personalised care options for individuals. And some of the best care you can see in diabetes and obesity is seen within South East London. It stands up to any national or international collaboration or comparison. But also the crucial thing for us is the variation we see in care, which I'll illustrate later on. And that variation occurs in healthcare delivery, and it occurs through healthcare access. We want to be very data-driven in this, very much focused on outcomes for diabetes and obesity, and building on a very strong track record we've got with diabetes and mental health, and diabetes and self-management, and really bringing those two approaches to this. So the Diabetes and Obesity Delivery Board has focused very much on creating a dashboard. This has been largely driven through working with primary care data from the whole of South East London, and has already given us some real insights into variation and into health access, which I'll illustrate. The crucial thing for us then is how we use that data and design our current interventions, our current approaches, and any new approaches, as my colleagues will illustrate. So this dashboard is very exciting, and we are very focused on being very data-driven at a population level in how we drive our program. This is already shown. I just want to highlight one or two of the crucial things here. We have significant difference in the prevalence of diabetes, which occurs partly because of different diversity of our population. And we have very different outcomes in how we deliver the processes of diabetes care, and our attainment of the processes varies enormously, as you can see. And also our achievement of, particularly I want to highlight 3 treatment targets. So these are the crucial things in diabetes to prevent premature morbidity and mortality. And you can just see how much that varies from ward and borough to other ward and borough. So our crucial thing here has to be to address that variation. And you'll see significant amounts of that variation is driven by both deprivation and by diversity, with real spread in how those things are achieved. So we want this to be the real focus of our work. It has been historically, and particularly working across our diabetes, physical and mental health work to try and address this. I'll just finish by highlighting one particular area which we're focusing on at the moment. This is a type 1 diabetes transformation project. This largely affects people from working age diabetes, so a younger population. And really, again, you see the same spread. So our aim here is very much to address differences in access. 30% of people with type 1 don't access any care relevant to their type 1 diabetes. And the ICS is driving that, and it's very much trying to get the partners working together. And a large part of the driver for this is going to be the mental health of people with type 1 diabetes and how addressing that helps people to engage better in care and achieve better outcomes. So having given that partnership overview, I want to invite my colleague, Dr. Vas, to talk about another specific aspect, diabetes foot care.
Thank you. Thank you, Steve. I'm going to talk about how clinical transformation through KHP has driven innovation at King's Health Partners. And partly this is significantly influenced by the data that we have. We know diabetic foot is common in people with diabetes, but the outcomes are hugely unpredictable, and there's a huge local and national variation. We know that if you see individuals early, we can get good outcomes. And from the national audit, we also know that there is a key focus in developing good pathways and minimizing the time that is taken for us to see these individuals to achieve good limb salvage outcomes. So on what we did, working with KHP and working with our local partners across, we broke the tradition where in the past individuals with these conditions were mainly seen either at Guy's and St. Thomas or at King's. We went and worked with our local partners to develop a KHP-wide Southeast London foot network, and this allowed us to develop new services at Greenwich, at Bexley and at Bromley, and which were supported by King's and GSTT. This allowed us to give care to individuals locally at the point of delivery. People didn't have to travel a long distance. And to do this, we also developed better coordination. We are one of the few centres across the country to have this coordination. And using a diabetic foot navigator, we are now able to coordinate the care of these patients and in an area that they can easily access. And on this graph over here, the pie chart shows where our patients are coming from. And a huge number of patients come from areas of Bexley and Bromley. And we now, through this transformation, through innovation, are able to deliver care for these individuals locally. And also this helps our carers, the care providers, the podiatrists, the GPs, they're able to navigate the patients much more easily. And it's not just clinical transformation through innovation that we're doing. We are also supporting education, and we are supporting mental health. And what has this meant? This has meant that from 2016, from before we established all this, to 2020, just before COVID, we've seen a decrease in our major amputation rates. That is the main marker of our outcomes. And so we look forward to, as we come out of COVID, to further establish this network and refine it further. I'll hand over to Dr. Duncan now.
Thank you, Prash. Thank you. So I'm going to present on how we've used data to identify a health inequality, and then through partnership working, develop an innovative intervention to address this. So we've seen that the rates of obesity in South London are very high, and particularly highest amongst the Black African and Black Caribbean communities. And unfortunately, people from the Black African, Black Caribbean communities don't engage well with existing weight management programs. And when they do, they have poorer outcomes when compared to people from white ethnicities. Just some background before I move on to the intervention. So we have, in the NHS, we have a tiered structure to obesity management. So this pyramid on the left-hand side, at the bottom, tier 1 is health promotion with GPs, but I'm going to focus on tier 2, which is community interventions. And this is where we've developed this innovative approach that I was talking about. Tier 3 and Tier 4 are more complex interventions, including pharmacology and surgery. And out of Guy's and St Thomas's, we do deliver Tier 2, Tier 3 and Tier 4 interventions. So as I said, Black African and Black Caribbean people do have poorer engagement and outcomes from existing weight management programs. And in Lewisham, this was seen as a particular problem. Lewisham has a very high proportion of people from the communities. And they used some funding from Public Health England to seek a provider to develop a new intervention. So this is where the collaboration with partners came in. So myself from Guy's and St Thomas's, together with Dr. Louise Goff from KCL, and then some grassroots organisations led by Shola Oladipo. We proposed using proven co-design methodology to work with the African and Caribbean community leaders and commissioners, service providers and community organisations to develop something new. So we used focus groups, interviews, co-production workshops, and shared decision-making to come up with the format and content of this new intervention. Now, on the left-hand column in this slide, the co-design themes, these were the themes that came out of the co-design sessions. So we could immediately see, for example, that a quarter of Lewisham's Black residents are not registered with primary care and so couldn't be referred using the normal means to weight management programs. So we, on the right-hand side for the intervention, we felt it was important to include self-referral as well as from primary care. And then on the second row there, the co-design theme was participants said that the program needs to be for us and about the foods that we eat. Traditionally, weight management programs, of course, don't focus on African and Caribbean foods. And so we made sure that we included that in this new intervention. The third row, that the intervention should be delivered by people who look like us, and so we did that. So all of our facilitators are of Black heritage. Now, I won't take you through the rest of the themes, but I do want to tell you that the pilot has been running for 6 months now, and I'm not allowed to tell you the outcomes because they haven't been presented to the Lewisham Commissioners yet, but I can tell you that they have far exceeded all of our expectations. Here are some comments from participants. So the yellow speech bubble, for example, I've been waiting for this all of my life. In blue, it was a life-changing journey. I never knew exercise could be such fun. Thank you for helping us on our journey to a healthier life. And then the green speech bubble, this is an important local resource targeting the African Caribbean communities because it's a safe and confidential space with like-minded group members. The support network of walking groups, the quality of discussion, and the efforts to collectively find solutions for everyday issues and concerns are important, and thank you to each and every one of you. And I can say as a clinician, I have never worked on an intervention before where we've had 96% of participants say that they would strongly recommend the program to someone else, which is just fantastic to be able to report on. So thank you. If you want to connect with us in the Diabetes, Endocrinology and Obesity Partnership, you can sign up for our newsletter as shown on this slide. And then there's our links on social media and our website. Thank you for listening.